Hello everyone, my name is Sanjana Buddi, and I was a part of the COVID mitigation group. So our study that we had to analyze was titled, How Good is Good Enough for COVID-19 Apps? The Influence of Benefits, Accuracy, and Privacy on the Willingness to Adopt. I have also included the citation in APA format. So, moving on to the purpose and hypothesis of this study, when we look at countries that actively combated the rise of the COVID-19 related cases early in 2020, one common factor in eliminating the risk of spreading the pandemic was contact tracking. To supplement manual contact tracking, a rising variety of contact tracing apps are being created and have been created. One critical concern is whether consumers would be willing to utilize these contact tracing applications. In the study, researchers utilized questionnaires to determine how effectively COVID-19 applications must operate for consumers to be willing to embrace them. They then presented the findings of a series of polls of 4,615 Americans sampled using both crowdsourcing and internet survey panels that can meet census representative demographic criteria. The purpose of doing this was to understand if people would be willing to participate in research in order to track down and stop the spread of the pandemic. Now, moving on, we're going to be discussing some of the major findings of this research study. One was the influence of political views. So, as expected, politics had a very big influence in understanding the developments of the pandemic and the vaccine. People who align themselves as being more left or democratic ended up having a more positive view on the contact tracing applications and were more willing to download them. People that had personally been affected by the pandemic were also more likely to download the contact tracing applications. If they knew someone that had negatively been impacted, they also were more likely to download the application. Number 3, they actually studied the intention of downloading the app, as I discussed before. Not only were they looking at what influenced people's perspectives towards the pandemic and contact tracing, but the actual intention of downloading the app. And finally, we move on to privacy, which is pretty significant. A lot of people viewed having contact tracing or being forced to use contact tracing as a violation of privacy. So a lot of people were unwilling to have their privacy violated because they were unaware of what this data collection was going to be used to do in ways that did not primarily associate with COVID-19. So with the concern of a data breach and having all this information leaked, a lot of people did not feel okay with having their privacy violated in this situation, but a lot of people, especially those who align themselves as being liberal, felt a lot more comfortable with having their information gathered and tracked in order to make sure that the pandemic was stopped and that public safety was a priority, so they were willing to sacrifice this part of their privacy in order to help the public. Moving on, we're going to go into understanding the testing of the hypothesis. In order to execute the accuracy of the hypothesis that was proposed in the paper, the researchers wrote out and published a series of questionnaires. In the paper, they were able to discuss their questionnaires, questionnaire validation, sample methods, analytic methods, and their work limitations. The Microsoft Research IRB, a nationally recognized ethical review body, authorized all of the research that was conducted. Now moving on, we're going to be discussing the reliability and accuracy of the data and materials that were gathered. When doing this, I think it's critical to understand a researcher's background, so I was able to include on this slide 2 researchers that were a part of the research and a little bit about their background information. The second thing that I decided to consult in understanding the accuracy of this research paper was the collection of data. Not only were the researchers able to provide accurate data, but they were able to show how they gathered that data. And considering all of the testing and the questionnaires that they used, I found that it was extremely reliable and accurate. I also spent some time reviewing citations and vetting through how many citations they used, and allowed myself to understand how reliable this paper was, and I do believe that it is reliable and accurate. Moving on to Kling and understanding social informatics, as stated in our readings, we were able to understand that social informatics, in a way, identifies a body of research that examines the social aspects of computerization, and considering how prominent technology has become, especially during this pandemic, it's important to understand that it can be used in helping stop the pandemic, but as expected, there are a lot of social parts of society that may prevent us from utilizing technology and having an increased dependence on it, whether that is a good or bad thing. And it's critical to understand politics, people's perspectives, the emotional factor in understanding how willing people are to be on depending on technology versus prioritizing their privacy. So I believe that Kling's analysis on social informatics and how critical it is in understanding social behavior is particularly impactful in understanding the rise of the pandemic and how America tried to stop the spread of the pandemic.